Assalamualaikum and hi! Welcome back to the second episode of Cho. Hi, and I am your host today. My name is Aida. Welcome and thank you very much, guys, for coming back again to Cho, the second episode of Cho. It is a podcast. A clubhouse, but for everybody. So now we are live on Facebook, MMU Malaysia, as well as MMU Malaysia TV, YouTube. So thank you very much, guys, for coming in for today's show. And we are so excited to have you guys today because our topic for today is about the title is "It's Okay Not to Be Okay," and we have a lot of stories and sharing session that we want to share with you guys today. And I hope you guys will tune in until the very end of the show. And before that, if you guys can see on the screen right now, is we're gonna have a little bit different. Is that if you see on your left side of the screen, you can see there is a QR code where you guys can scan, and it will bring you guys to a platform called Slido, where you can actually post any question, any comments, or anything, just about anything that you guys want to say during our live session, but it will remain anonymous. You guys don't have to worry because we're not going to reveal who you are and what are you what comment that you are giving at the Slido. But if you feel that you don't want to comment on Slido, you can always comment on the YouTube comment section as well as the Facebook comment section about anything that you guys want to say or ask during the session. Because definitely, I believe you guys gonna have a lot of question with our speaker later because she's going to share a lot of things today with us. So if you guys have any question in between the session, please drop any of the question on the YouTube as well as Facebook and also Slido. We'll be tuning into you guys' question. All right. So about today title is "It's Okay Not to Be Okay." All right. The title. What is it gonna be about? I bet you guys are curious, right? Don't worry, I am not alone today. I'm definitely not alone today because today we have a wonderful person that we have invited from Hospital Shah Alam. She's a psychiatrist at Hospital Shah Alam. She has an experience of 12 years working at the Kementerian Kesihatan Malaysia. And right now, she is a member of the Young Mind Malaysia. And she is here today to share with us about a discussion that we will tell you guys in a bit, just a little bit. But before that, let us welcome Dr. Nuru Shahida. Dr. Nuru, hi, how are you?
Hello, I'm fine. Hello, assalamualaikum, and good afternoon, everyone. Well, I hope everyone is in a good health today. And thank you, MMU, for inviting me. I feel so excited to be with all of you today. I'm Dr. Nuru Syuhaida. I'm a psychiatrist in Hospital Shah Alam, and I'm also a fellow in Young Minds Malaysia. Hi. Oh,
Therefore,
I love pink very, very much.
oh, nice, 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 nice. Yeah, okay. I mean,
Yes.
like, it's very cute. And also, I'm wearing pink, actually, doctor. Oh,
Oh,
it's like a matching.
yeah.
Even
Yes.
our back screen is also pink. So, yeah, it's kind of like a match
Yes.
for everyone today. So, again, thank you
We
very much, doctor, for coming today. And we're
You
also
are
excited to
welcome.
listen to your sharing today because our topic is quite heavy, but we are going to put it in a very casual way so that everyone can enjoy the show as well as
Yes.
have some input about today's sharing session, doctor, isn't it?
Sure. Can
Yeah,
can no
sure.
problem.
Okay. So, if you guys are ready for today's show, can I see on Facebook and also YouTube, you guys are on Slido, you guys say choke. Let us see for a while, like on choke. Is everyone there? Okay, I think everyone's just start to come in. All right, some showing a smiley face already on Facebook. I guess we are ready to discuss about it, doctor. Okay.
Yes.
All right. All right. Woo. Okay. But doctor, before we go into the topic, I guess we need to clarify it with everybody first. Is that the title is okay not to be okay. Some may associate it as, are we talking about a Korean drama today? Because there is a Korean drama of the same name and Kim So Hyun was in it. So most probably everyone will be like, "Ooh, are they going to talk about Kim So Hyun today?" But definitely no, we're not
Yes.
going to talk about Kim So Hyun today. Okay, we're not going to talk about K drama today. We are going to talk specifically about mental health issue that is anxiety because Dr. Shu is a psychiatrist and she has deal with a lot of patients with anxiety. Even in the Young Mind Malaysia, she has deal with a lot of people coming in with anxiety, and she's going to share with us about this topic today.
Yes.
And yeah, we are going to talk about that topic today.
Yes.
So to go into it is that Dr. Shu, right now, not only in my generation, but I believe everyone right now, in the uncertainty of time that we are facing right now during the pandemic and the MCO, and there's a
Mm-hmm.
lot of new norm. Even right now, we are doing something different. We are live virtually from home. You are from your home. I'm from my home. So we are facing such an uncertainty in our life that it's actually bring a lot of anxiety to people because they don't know what to expect after this, what to expect next, and what to do next. So, doctor, can you tell us and clarify to us what does anxiety means actually?
Thank you, Aida. I think this topic is very much relevant in today's context. Even now, in doing webinar online, is also cause a lot of anxiety. Rather than if you call me physically, so I think it is less anxiety because we can talk, we can see people, we can see the movement of people talking to us. But now, because everything is new norm, so we are talking outside like this, so it's very very anxiety provoking, especially I'm worried if the data is not enough.
True,
And
doctor.
yes, I'm worried that sometimes it might just shut off just like that. Well, when we talk about this anxiety, all right, there's a difference between anxiety and anxiety disorder. So, anxiety is a normal human emotion. We all do have emotion. We feel sad, we feel happy, we feel angry, we feel guilty, and anxiety is one of the human emotion, and we need anxiety. Otherwise, if we don't have anxiety, for example, if I don't have anxiety, I won't be able to be online on time because I'll just be leisure kan, because I don't have any anxiety. What should I worry about kan? I don't have to finish my homework because I'm not feeling anxious at all. So by having this anxiety, it helps us to move further, and it helps us to move forward. However, when this anxiety levels it out of proportionate to the stress that you have, all right, stress is not it is not illness. Stress is also one of the things that we need in our life, because stress is something like the work, for example homework, the task, it is, we call it stress. So if the anxiety is out of the proportionate to the level of stress that we have, then and it's affecting your functioning, then we call it anxiety disorder. And below this anxiety disorder is just a big picture. Yeah. So below this anxiety disorder, there are few types of anxiety. All right. Namely like panic disorder, generalized anxiety disorder, specific phobia. We do have this selective mutism and many more. So I'm going to talk about that later. And when we talk about anxiety, we are going to talk a lot about expectation, and managing anxiety is about managing your expectation. Yes.
Ah, I see. So there's a difference between the normal anxiety that we have and another anxiety that is more described as panic disorder, anxiety attack that we get. That is different if we are beyond that, isn't it, doctor?
Yes, true.
Yeah, okay. So it means that if I'm having the feeling of guilty, that is a normal anxiety for me. Like if I'm feeling angry, sad, so that is normal for us to have those kind of anxiety because it's normal for us. But doctor is just were wondering like, well, how about the other anxiety that we get? That is the panic anxiety, the anxiety disorder, panic anxiety attack. So why do people sometimes get that kind of anxiety?
Okay. Why do we get anxiety? There is no single answer to answer that. So it is not like diabetes. So for example, when you said about diabetes, so it is all about your insulin resistance. We can say that because your dextrose stick is high, so you have the diabetes. But it is not from any mental disorder, because any mental disorder is a mixture of so many factors. So when we talk about illness, for example, is anxiety disorder, it is a mixture of bio, psycho, social, spiritual, and lifestyle. So, and this is why when you come to see us in the hospital, so in the first visit, usually doctor will spend quite a lengthy time, all right? For example, about 45 minutes to 1 hour, just to get enough history from you, because we need to establish, we need to formulate your case, because we need to find what is the reason for you to have this kind of symptoms. So, for example, in anxiety disorder biology, you could have the family members persons who have anxiety disorder, or you could have any illness, okay, other than mental illness. For example, you have thyroid disorder, you have this lung problem, you have like heart problem that may cause the symptoms similar to anxiety. And usually when you go to the hospital, we don't simply say, oh, you have this psychiatric illness. We need to rule out any organic cause first. I mean, any medical cause that can be treated before we go that, oh, you have this anxiety disorder. All right. That's for biology. All right. And then psychology, for example, your parenting, your nature, your nurture. Okay. Some people, they have a very strict parent. Okay. Very strict parent. I mean, you cannot say anything. You will be just white off. All right. You'll just be cane off. All right. Or you may have this childhood abuse or any emotional trauma when you are a child. So it may precipitate for you to have anxiety. And socially, like what we are having currently, like this environmental stressor, COVID, all right, COVID, the new norm, this can also cause us to have anxiety. And like family issues, relationship issues, you broke up with your boyfriend, you broke up with your girlfriend, so it can cause you anxiety also. Unemployment, all right, these uncertainties about education and our low self-esteem is concealed in this social and spiritual. So if we have a good spiritual, so we have something to hold on. So when we feel anxious, so we can go back to God. But sometimes if we don't have a good relationship with God, with Allah, with our Tuhan, so this may cause us to feel anxious more. And also the lifestyle. All right, some people, they took drugs to help ease that they have a lot of problems, so they took drugs. So substance use, for example, alcohol, marijuana, um, uh, methamphetamine, it can cause you to have anxiety and an expectation about the lifestyle. So you want a very luxury lifestyle, kan? Like macam sekarang yang tengah famous, now the famous case is our sugar baby, sugar daddies. They do live in anxiety because of the lifestyle. So this is a constellation of problem to formulate that cause you to have anxiety. There's no single risk factor for us to determine, oh, you have anxiety because of this. No, it's a
Hmm.
mixture. Yeah.
I see. That's very interesting because usually when people say you have anxiety, they will always say because you have a psychologist issue, because you have like your mental is not good, like you have some sort going on your mind that make you having the anxiety attack and everything. But I guess today we can see that actually it is separated to biological, to the environment, social, and also to psychologists also. So it does not really depends on one method. It can also because of the people, because of the situation that make us having that anxiety. Because yeah, definitely doctor, because right now I believe not only just me but also a lot of people who are having a lot of anxiety right now because of the current situation, the pandemic. There's a lot of uncertainty to it, doctor,
Yes.
right?
Yeah.
How about you, doctor? Like is the current pandemic situation is giving you a lot of anxiety to it?
Of
Uncertain?
course, of course,
Really?
because people say that, okay, so a lot of people, they work from home, all right, but for us, for a doctor, so there's no such thing as work from home, okay, because actually we need to work more because of this anxiety, because of this COVID, all right. Our medical team stand by for the COVID, and then my medical officer need to be deployed into the COVID center, and the psychiatrist, psychologists need to be prepared for the psychological assessment and psychological first aid for a lot of people affected with the psychological issues during the anxiety. So this is the thing that actually the new norm for us. But of course, when there is a challenges, there's always the answer for that.
Yeah, that is true, doctor. And talking about answer, definitely we want to know, doctor, like when we have the anxiety, sometimes there are people that keep it to themselves for a very long time. They know that sometimes they have this anxiety, but they keep it to a very long time to the point that they blow up. That they having panic disorder, they have a panic attack. Like when you know, like panic attack, when suddenly when you're talking, suddenly you have this hazy and blurry, you feel confused, and maybe you have a short of breath. So those kind of thing that we always associate as you having an anxiety attack.
Mhm.
But before we have that anxiety attack, can you share with us what can be the main symptom that can we see either to ourselves or to our friend that we know that person is having a symptom of anxiety? What do you say, doctor?
All right. So first, you need to open your mind for any possibilities. All right. If you want, I mean, if your friends show that they have some symptoms, so open your mind. Okay. It is not means that if they have this anxiety disorder or any mental disorder, usually people will say that, oh, you have lemah iman. So please bring out all this stigma out, because this anxiety is a true story. All right. And anxiety is real. All right. So anxiety is real, and it is a very, very painful experience. Okay. So how do you know that you have anxiety? What is the symptom of anxiety? It depends on the type of anxiety that you are having. All right. For example, if, okay, like I said before, there is a generalized anxiety disorder, panic disorder, specific phobia, selective mutism, separation anxiety, agoraphobia, and social anxiety disorder. All right. So, okay, if you have this generalized anxiety disorder, all right, what do you symptoms that you are presented with is that you presented with excessive worriness. So you are easily worried for everything. Semua you risau, all right? Semua you risau. So you apa? If somebody come back late, also you risau. All right, your homework or already almost finishing, also you risau. I mean, sometimes there's no such thing. There's no basis for you to risau. All right. Okay, so you risau about everything. You risau about your cats. You risau about your house. You risau about your boyfriend. You risau about your girlfriend. So there's no single things that you can point out. Because when you say to other people, I think it is quite manageable. But for the patient, it is very, very disturbing. And it causes you to have very restlessness and mental fatigue. All right. Second, if you have panic disorder, all right, panic disorder, you presented with a sudden onset of recurrent panic attack. Sudden, unexpected, recurrent onset of panic attack. And this panic attack is presented with physical and psychological symptom. So for physical symptom, you will present it with palpitation, chest tightness, your numbness, your tingling sensation of the upper limb, lower limb, and you feel choking. You feel like you have you nausea, vomiting, and it's just sudden, and it's occur about at least 10 to 20 minutes. And after that, it's resolved. All right. And psychological symptom is that you feel that you are dying. You feel that you are out of control. You
Oh, wow. Okay. Wait, Dr. Shu? Oh, Dr. Shu is having some technical issue right now. Ah, all right. So, if you guys are watching it right now, thank you for still watching it. We have some technical issue with Dr. Shu. She will come back with us to share a little bit more about the symptom just now. So, what we have been talking about, if you guys just came in, thank you very much for coming to the second episode of Choke. What we have been discussing today is about anxiety, and the one that we have been discussed since the early one is the definition of anxiety, because we have been talking that anxiety does not only means about mental issue. It can be because the environment, because of the psychologists, the biologists, and the social. Because of this factor, it can cause you anxiety. And one point that she mentioned just now is about the general anxiety. That is, the general anxiety is about how we are facing every day. Because if you are sad, if you're angry, if you're anxious, everything that you are feeling right now, it means that you have a general anxiety. It means it is normal for you guys to have. Even myself, I have it. Like every time I woke up in the morning, sometimes I feel that, oh, I feel so angry today because I wake up so late. I'm late for class. So those kind are considered as generalized anxiety. But another part she mentioned is about the specific one where we. Oh, doctor, you have come back. All right. So, all right. Okay, doctor is here. Hi, doctor. Welcome
okay.
back.
I'm so sorry. I'm just talking and talking, and I suddenly hear that everyone is.
Yeah.
This is another challenges and cause anxiety in the
Yeah.
webinar.
Yes, definitely. It caused an
Yeah.
anxiety for me just now. Like, oh my God, doctor is suddenly
Yeah.
lost. Okay, this is very
And,
interesting,
and
doctor.
I'm
So,
and I'm also anxious because of that. So where
yeah,
do I
definitely.
stop just now?
We were talking about the symptom. You were talking about the symptom just now on the specific one.
Panic disorder.
Yes, the panic disorder part, doctor.
All right. Okay. All right. So the panic disorder. So I think we go for specific phobia. All right.
Mm-hmm.
So specific phobia, you have this intense fear of a specific object or situation. All right. For example, example, height. For example, you are afraid of flying. All right, you are afraid of you are afraid of going into the lift, or maybe you are afraid to go into the closed space. Or maybe for me, I'm very afraid of cockroach, so I cannot tolerate cockroach. So if I see cockroach, I can scream. I think I can scream my heart out lah. All right. So and it caused me palpitation, and it caused me very. I mean, I can have panic attack if I see cockroach. So this is specific phobia. For selective mutism, right? So selective mutism is usually occur in the young kids. So usually when they talk normally at home, but when they go to school, they didn't talk at all. Okay, I mean, people said whether this child, whether they are mute, all right, but they have this selective mutism. Social anxiety disorder is when you worry or self-conscious about people judging you. Okay, all right.
Mm-hmm.
So, for example, you are giving talk in front of public, and then
Mm-hmm.
you cannot give talk, and you can have panic attack when you have to give talk in front of other people, because you worried that people are judging you. People are judging you because of your appearance. People are judging you because of your pronunciation, and so on. All right, this is a social anxiety disorder, and that's why people with social anxiety disorder, they are difficult to mix around with people. They are difficult to come in front. All right, separation anxiety. Usually you see when you send your kindergarten go to school, and they will cry and then you cannot separate from the parent. But also this can occur in adult, and they are anxious when the loved one leave you. And agoraphobia, one more thing is agoraphobia, you have intense fear to go to a certain places in which you know that there is no help available for you. For example, you are going to the pasar malam. Of course, this pasar malam has a lot of people, but you are worried if you get panic attack there, there's no one will help you. So this is agoraphobia. And of course, when we talk about the symptom, we talk based on our diagnostical statistical manual, DSM. All right. If previously the DSM-4, now we are using DSM-5. DSM-4 previously include obsessive compulsive disorder, and also post-traumatic stress disorder, and also acute stress reaction into the anxiety. But now this OCD, PTSD is already removed from the classification. All right, so just live with that symptom. Yeah,
I
back to you.
see. Wow. Yeah, there's a lot of symptom that usually we see a very general one where people are having fear or even having, those kind of feeling that is really easy to be read. But what we didn't know that is a specific one on how the symptom can be or not organized. It can be noted down that we don't know about it. Only when we go to psychiatry talking to
Yeah.
you, then we can know that you are having this symptom because of this is the symptom that we don't know. So very interesting, doctor.
Yeah.
But then, doctor, but if
Yes.
we already know the symptom, all right, let's take the general one. Let's take the general one where we can see, because there's a question being asked before to us is that, because I have this general anxiety where I'm always feel conscious about everything that I do every day, even the people that I meet. I feel so conscious that it make me so anxiety, and it disrupt my daily life. Everything that I do is disrupted. So how can I manage it, doctor? How can we manage this anxiety?
All right. First, all right, you need to know that it's okay not to be okay. All right, it's okay to be diagnosed with a certain condition, because it is all about managing the expectation. When you are expecting yourself not having anything, so you are relaxed. I mean, you don't have to, you don't do anything. But if you know that you have something, so you need to work for it. So you need to know. So when you know that it is okay not to be okay, you need to acknowledge and get a correct diagnosis. All right. So when you get the correct diagnosis, you will be open to the treatment. All right. And again, when I talk about anxiety, like I mentioned before, anxiety is all about expectation. So our management is managing our expectation also. All right. Management is divided into two, all right, which is pharmacotherapy and also psychotherapy. In a very severe cases, so if you go to the doctors and it affected your functioning very, very much, so the doctor may tend to start you on medication. For example, they might start you an anxiolytic such as benzodiazepine to help you to calm down. So each time you have panic attacks, so you have to take these anxiolytics to help you calm down. All right. And sometimes the doctor may prescribe you with antidepressant. All right. Because the anxiety, when we talk about anxiety, maybe I forget to mention at the second question. So anxiety is okay. If we look back about the chemical involved, because our human, all right, our human brain consists of so many chemicals to work well, such as serotonin, dopamine, noradrenaline, and norepinephrine. All right, when you have anxiety, it's all about fight or flight reaction, and it's involved a lot of noradrenaline. So you need the medication to manage or to stabilize your adrenaline, such as and to manage your serotonin. So we need this antidepressant, and it works also as anti-anxiety. So we need this serotonin, some kind of medication that provide you and balance out your serotonin, all right, which is antidepressant and anti-anxiety. And if they some people with a little bit different diagnosis, they have this psychosis, which is hallucination, and because of their so severe anxiety, or maybe they have this depression, and depression causes you to have anxiety, but actually it is a diagnosis of a psychotic, or maybe it's other severe diagnosis such as schizophrenia. But with the anxiety, you may need antipsychotic treatment. So this is for the treatment. But for anxiety, I would always say to my patient, the 50% is you're compliant to the medication, but 50% is you yourself have to manage your own anxiety. So how do you manage anxiety? Usually, the doctor will tell you about this is your diagnosis. So what we call it a psychoeducation. So we psychoeducate about the illness, and after that, other important thing is to do deep breathing technique. Okay, because you remember when I said panic attack just now, so they have a lot of chest pain, you feel palpitation, you feel shortness of breath. So you feel that you are out of control of yourself, right?
Okay.
So when you're out of control of yourself, so you don't know how to control yourself. But when you're able to take a very deep breath, it means that you are able to control yourself by taking a deep breath. So when all else that you cannot control, you can control your breathing. So that's why deep breathing has a very significant meaning in managing people with anxiety. All right.
I
And other things, a lot of people, when we say about anxiety, I again and again saying that it's all about expectation. And sometimes we have a very negative thought, and we have a very negative expectation towards ourselves. We want to be a superhuman, we want to be a super mom, we want to be a super student, right? So sometimes this expectation, it is difficult to achieve, or it is like it seems unreasonable. So we need to do CBT, or cognitive behavior therapy, so that we explain to you how to change from a negative thought into more rational thoughts. I'm not saying into a more positive thought, because it's very difficult to be positive, but you can be rational, because you know what we think will affect our emotions, and emotion will affect our behavior. So this one needs another lecture. Okay. All
Yeah,
right. And then
definitely.
yeah. Yes. And problem solving skill, of course, when you're expected to manage a lot of things, so problem solving skill is at most important in management of stress management or managing the anxiety. So I would suggest my patient to do list or journaling. So when you journal out all your problem, you know that the things that inside your mind is not so much, but because you put it into the paper, and you can see what is you're anxious about. So if you see, it is not so much. And when you list down what is your problem, you list down what is the solution. So you can see your solution, and you know that you are in control of yourself. Again, the key word is in anxiety, you feel that you are losing control. But in management, you need to gain the control of yourself. So by journaling, you gain control because you know what you need to do. All right. Another one more thing is you give time. You give a special date. Okay, like you give a special date with your boyfriend or girlfriend, you give a special date with your anxiety. So if you have a lot of thoughts coming to your mind, and then you tell to your mind, okay, I'm going to date you at 4:30 p.m. All right. So I'm going to date you at 4:30 p.m. It means that you do all other work. At 4:30, you will meet up with your anxiety. And at 4:30, think about all your anxiety. You give time for you to think about what you are worried about, what are you anxious about. But you know, the moment when you come into 4:30 p.m., you know that you have nothing to worry about, because actually it has nothing to be worried at the first place also. So yeah, so it is what we call like dating with your anxiety. And some
Mm.
people with a specific phobia, for example, they are worried of flight, all right, but they work as a pilot. So how? So okay, for example, kan, so they need to overcome the flight. For example, me previously, I'm very afraid of apart from cockroach, I also worried of blood. But because I need to be a doctor, so I need to see the blood. So I need to do the graded sensitization, in which, for example, you need to introduce the thing that you worried about slowly and slowly until the patient gain control. Remember, when you lose your control, anxiety is about losing control, and managing anxiety is about gaining control. And again, you need to depends on other specific problem that you have. For example, you have problem with your boyfriend or girlfriend, maybe you need to have couple therapy, or maybe you need and some people, they have a very painful past, for example childhood abuse, and this is very not easy to tackle. Maybe this kind of patient needs psychodynamic psychotherapy. We need to go to their past so that they are able to let go and able to forgive their past before they're able to stay in the present. And again,
Mm.
maintain a healthy diet, a regular exercise, sleep hygiene is very important, and also avoid substance use. All right. So
Mm.
don't take alcohol, don't take substance, because it causes you more anxiety. Yes.
Mm. Yeah, thank you very much, Dr. Shu. That is a very packed, packed kind of management on how you want to manage your anxiety, from getting the treatment, getting the 50% treatment and 50% on your health, being on your diet, on your way you think rationally about the anxiety, dating it. That's very interesting, Doctor. I never knew that we can actually date with anxiety. That is a very interesting fact,
Yes.
Doctor.
Let's date
Yeah.
with our anxiety.
Yeah, definitely. So, there is a very packed session that we have just now. There's a lot from the very first to the very end that we have, and I can see from Facebook and also Slido that there's a lot of question coming for you, Dr. Shu. Is it
Okay.
fine if we pull the time a little bit, because I know
Correct.
we only have time until 2:30? But is it okay if we pull a little bit of your time, Doctor?
Can, no problem.
All
Can.
right. So, again, for everyone who wants to ask any question, but if you feel you want to remain anonymous, please do so at Slido. And if you are on Facebook or YouTube, you have any question, please post any of your question. And since you guys are on Facebook and also YouTube, please subscribe to the MMU Malaysia Facebook as well as YouTube, and follow us for any new updates that we're going to share with you through our social media platform. All right. Okay, doctor. So let's go for the Q&A session right now. There's quite a few here. So let's go with the first one. It's related for the working class people. So the question say is that for working class people, every day we wake up, we get ready, we commute to work, working from 8 to 5, and we always try to keep a positive mindset about it, because we are doing not only for ourselves but also for our family, for the community, and etc. But then how can we let the people around us know that sometimes we have the right to feel not okay and sometimes to have a negative thought on certain matter?
Okay, all right. How do we let other people know? Okay, it's very difficult because it's very difficult because it is very difficult to change people. It's very difficult to change people and to change other people's perspective. But again, in anxiety, it's all about choosing what you can control and letting go what you cannot control. So you choose what's matter to you. For example, your thought about you, all right, your thought about the environment, your thought about your job, your thought about your work. But it is very difficult for us to change other people. Like, I mean, okay, I mean, you need to empathize to me. Okay, you need to understand me. It's very difficult because people don't stay. I mean, when we grow up, we didn't grow up in the same environment. So they have their different opinion, they have a different perspective of life. So choose what you can control and let go what you cannot control. So
Mm.
and again, it is very difficult to think positive. All right, for example, when I say to you, just not think about the pink elephant. Of course, in your mind, you will think about the pink elephant. Okay, don't think about the pink elephant. Don't think about the pink elephant. But the pink elephant will come to your mind. So when you talk about positive, it's very difficult. But being rational is the most easiest way to do. For example, of course, being rational means that you are allowed yourself to a certain negativity. So I feel that today I feel sad. All right, but sadness is not negative actually. When you feel sad, sad, you cannot understand what is the meaning of happiness if you don't experience sadness. So just allow yourself to feel a certain amount of emotion. Unless it's affecting your functioning, then it is not healthy. But if you feel sad and then you feel happy, then you feel guilty, but you are able to function, then it's okay. All right. And again,
Mm.
it's okay not to be okay.
Yeah, definitely. It's okay not to be okay, doctor. So to everyone who's watching us right now on YouTube, on Facebook, it's okay for you guys not to be okay. There are certain days that we can feel like that. And if you guys are watching it right now, please do check on yourself asking, am I feeling anxiety today? Do have a checklist on it. Go and have a date and, just do something to make sure that you are not too anxiety about everything. Just calm down. Just think rational about what Dr. Shu has mentioned just now. Okay. So moving on to the next question is about from Facebook. We have is that okay, this is from a student perspective. I believe this is I don't a student perspective. I think sometimes not only student but a lot of people also including housewife, working parents or working class people is that they want to know is that may I know how to overcome overthinking issue. I believe this is something that Dr. Shu sendiri, you experience yourself. Sometimes we overthink a lot of things and eventually it become anxiety for us. Well, how do we want to overcome this method, doctor?
Okay, thank you for your question. So this is what we call the problem solving, and this is what we call we need to see what you think. All right, because overthinking comes when you didn't write anything about what you are thinking of. Because when you think everything is in your mind, so it's mixed up with so many things. It mixed up with your previous experience. It's mixed up with your emotion at that time. It's mixed up with your emotion with your boss. It mixes up with so many things. So it becomes overthinking. But this is what I suggest when I talk about your listing or journaling. So if you think that you feel very overthinking, please write down what you are thinking of. All right, write down one by one. For example, you are worried you cannot go out because of the MCO. You are worried because you think that you cannot cook very well. You are worried because of there's so many police on roadblock. You are worried of so many things. So just write down, even it is a very ridiculous thing that you are thinking. So when you see this in the paper, and then you try to think, you try to make a problem solving. Okay, for example, you cannot go out for the MCO, but what can you do at home? So you just put a point there. And for example, there's so many police on the roadblock. So what are you worried about the police, right? For example, you worried that the police might fine you with 1,000 ringgit. But you need to put a solution. If I follow the SOP, then I'll be okay. So if you know that everything has the answer on the paper, it will help you to lessen your overthinking. And again,
Mm,
if you have overthinking, please date with your anxiety and overthinking. Dear mind, dear mind, I'm meeting you
yeah.
at 4:30. Now I have other things to do. So I have made an appointment to you at 4:30. So I'm meeting you at 4:30. And
Yeah.
realizing when you go to 4:30, actually this thing actually not so much because it is nothing to begin with at the first place. Yes.
Wow. Okay. That's
Yes.
very interesting. Dating and also listing out. I believe this is the two things that we can start immediately after the session is to just list out
Yes.
all your worries, all your anxiety and try to find a problem with it and then go and date with it if it necessary. Very, very interesting out there because sometimes we do not write out because we only have in our mind. So we don't write out. So it become overthinking. So yeah, it's a great for everyone who's watching right now, do so after this. Write out everything that you have in your mind and overcome it one by one so that you will have less anxiety. Thank you very much, doctor, for it. Okay. All right. We can have another one questions. Since we are very
Okay.
limited of time, doctor. Even though we would like to, yeah. Thank you very. I mean, today's session we have a lot of questions regarding anxiety, and a lot of people have a lot of answer. But time is very jealous of us, so we can just go for another one last question for today. Is it okay with you, doctor?
Okay. Yes, okay, no problem.
Okay. This is question from Slido is asking is that doctor, may I ask PTSD considered as a type of anxiety? I watched the words PTSD in a movie called The Good Doctor. So is PTSD is considered as a type of anxiety, doctor?
Okay. I maybe I already mentioned a little bit. Okay, last time, okay, in psychiatry, we use diagnostic and statistical manual to manage or to diagnose our patient. So we have this DSM. We call it DSM. DSM 1, 2, 3, 4, and 5. So last time we are using the DSM 4, but now we are moving towards not. I mean, we are using now the DSM 5. All right. So DSM-4, they consist the PTSD into the anxiety disorder. All right. So previously it is under the anxiety disorder. However, in DSM-5, it has a section on its own, which is a post-traumatic stress disorder. It has a section on its own. So because the symptom itself, it may or may not have a panic attack in it. However, it has more symptoms to suggest it's it has more symptoms, which is very typical of the post-traumatic stress disorder, to make them into a different group of their own. So people with PTSD, they experience re-experiencing the trauma. They have a nightmare. They have this hyper arousal, in which when they think about the trauma that they're facing previously, so the mind is become a very hyper arousal towards the stressor that they are having. So it's a different group right now, but whatever it is, the treatment is almost the same. However, in PTSD, it has a specific psychotherapy that they need to undergo, because they need to let go of the trauma of the past that they are having. Yes.
I see. Okay, so PTSD is another category of it. Right. Thank you, doctor. By the way, doctor, I just got a green light from our director. Actually, my director said it's okay. We can proceed with more question. Is that okay with you, doctor?
Okay, can. One more.
Because it
Yes.
seems like it's a very important topic to everyone right now. It seems like everyone have a lot of question and eager for to listen to your answer. So we're gonna proceed with a few more Q&A. So the next question is from YouTube asking is that, may I know how can we help our friends with anxiety?
Okay. All right. First, okay, you need to acknowledge your friend has anxiety. And then second, the support system for people who have anxiety is very, very important. So when you have the friend who have the anxiety, let them talk to you, okay? And support them for the things that they feel and the things that they wanted to tell you. So this is how you support them. And again, people with anxiety, they need reassurance. They need a recurrent reassurance, or so when they feel unsure about themselves, so as a friend you can reassure them that they are doing fine, that they are doing good, and it's okay not to feel okay and not to be okay. So and when you have this panic attack, okay, and you as a friend, you happen to be there, so please remind your friend to do deep breathing technique. All right, take a deep breath and relieve. Okay, take a deep breath and relieve. And because sometimes when people during their panic attack stage, they cannot do anything, because the mind just go blank. They just feel very lost. So you as a friend, if you see your friend having the panic attack symptom, so you can remind them to do deep breathing. You can remind them to do mindfulness. Mindfulness is looking at the environment and just describe the environment based on your five sense: your gustatory, your olfactory, your touch, your smell, and your eyes. Your sight. So you describe your environment for your friend to come back. And after that, please, if your friend did not want to see a doctor, please advise your friends to go and see the doctor to get the treatment. And if your friend is not compliant to the medication, please advise your friend to compliant to the medication, and be there. Do not be judgmental for your friend. Okay, some people, they're just being we call it they're just being like, I mean, they feel that okay, please give emotional validation to your friend. For example, they said that I feel very scared. Oh, you can say that I can imagine that you are scared, I can see that you are scared. But if your friend say I'm very scared, and then you pula as a friend, you cakap, tak ada apa lah nak takut, benda sikit je kan, tak ada apa.
Mm.
So it is just like we are giving comment and we're judgmental. So please do not be judgmental. Support them to get the treatment, support them to be compliant to the treatment, and be there during the journey. And again,
Mm.
anxiety is a highly treatable, and anxiety is a journey. It is not a destination. So it is not like you makan ubat hari ni and you akan makan macam makan Panadol. Makan ubat hari ni, hilang sakit esok. No, it doesn't work like that. You need a certain amount. You need, maybe it's a lifelong, because again, the risk factor, it could be the childhood trauma. The risk factor,
Mm.
it could be the thing that has been implanted to you since a very child. It's a very long time ago. So you need to have time. Give yourself a time to experience the healing. Yes.
That's very, very important for us. I mean, when we know our friend having anxiety, the most important part first is to always be there for them, because we don't know what are they having on our mind. And I believe, without being judgmental to them, just being there and listen to their problem and listen to what they are facing is definitely important as a friend who wants to help our friend going through the anxiety
And I
part
add
and
some
everything. Mm-hmm.
can I add some also? And just
Yeah.
some people who has a very severe anxiety, so sometimes they think that they are doing but they think that they almost wanted to do self harm because they cannot tolerate the anxiety. So as a friend, please advise your friend to go to the hospital. And or if you stay with your friend, okay, at home, please see any other sharps or the thing that dangerous that your friend might use, so please put it away, so that it can help with your management of your friend's self harm. All right.
All right. Okay. So, Doctor, we have the final two questions to ask from our audience today. Is number one is they want to ask how best is from the Sabah training and resources from YouTube. Asking is that how best should we manage our social media in terms of getting our best mental state. Definitely, this is very important, because social media is we are using it every day. We are looking at it every day. So, what is the best way to manage our social media in getting the best of our mental state?
Okay. Social media is something that is very, very important. It is very beneficial. We get a lot of knowledge from the social media, but sometimes we get a lot of anxiety from the social media also. All right, because of what? Because of the expectation also. So the expectation, we have a lot of expectation when we see our social media. For example, if we see other people posting something and we think that okay, I want that, but I cannot get that. So it causes you anxiety also. So how do you manage that? I think again, scheduling your time to your social media. You need to have a certain amount of time that you dedicated for your social media, and please say no to the social media after a certain amount of after a certain time. Okay, it is like dating with the social media also. All right, so you give time. Okay, please limit your time, maybe 1 hour or 2 hours a day, or in case if you think that maybe you can just shut down on the certain things that it might cause you or anxiety triggering. You may unfollow, or you may some people, they are just very anxiety provoking. All right, for example, one of your friend is very anxiety provoking, and sometimes they just put a status that is very, I don't know, but maybe you feel that it is point to you, but maybe that if you think that the person is so toxic to you, so maybe you can just unblock. That's why we have this unblock
Mm,
button. So you just
yeah,
need to be assertive to you need to be assertive to yourself, because only you know what best for you. So and choose
definitely.
the social media that is soothing for you, that is suitable for your needs. Yeah.
Yeah, true. Unblock toxic people, and also have a time for your social media. Do not put too much time on it, because definitely it can give you a lot of anxiety, isn't it, Doctor? Yeah. Okay.
Yes.
And last question for today. Again, thank you everyone for asking question. You guys are so eager with the question, and we only have one last question for today. That is from Slido. The person is asking, Doctor, may I know what should I do? Is sometimes my emotion get overwhelmed. That is too sad, too anxious. Thus, it affect my appetite, which make me lose a lot of weight. So yeah, I sometimes happen also when I get too anxiety, I have so many stress, too sad, too anxious, and everything. It can really make me doesn't want to eat anything. So what should we do in the times like that?
Okay, so when you have the symptoms, all right, so okay, again, when you have anxiety, when you have sadness, so it's a normal reaction. It is a normal human emotion. We need to feel sad, we need to feel anxiety. But if you feel that you didn't able, I mean, the anxiety, it is long enough, the sadness is long enough, or the guilty is long enough until you loss of weight, you lose your appetite, and there is a significant reduction of your weight. Because of that, it is an indication that it is actually you need to see a doctor, because it's already affecting your functioning, it's already affecting your physically. And when you see a doctor, so they need to see you, to diagnose you, to rule out any organic cause that for you to have that. Or maybe you have this kind of thyroid issue. You know, there's a lot of people actually, they come with the anxiety, they come with depression. So when we take blood, so actually they have this thyroid issue, and when we treat their thyroid issue, they are actually back to normal. So it's not necessarily that you have this psychological anxiety disorder, but it is a thyroid induced anxiety disorder. And once thyroid hormone is normalized, so you are okay. And we need to find out the reason why are you losing the appetite. And
Mm.
maybe and if you have other things, for example, the things that you are worried about, again, I will advise my patient to do listing. All right, what can you handle at this moment? So list down what is your problem, and then you pick out which one that you can handle first. All right, maybe the appetite is not easy to come. All right, but if you feel that you are in control with yourself, the appetite will come. um, it will follow you. Okay, so it will follow you once you settle all your problem. Okay,
Mm.
but at the same time, please don't jangan melayan perasaan lah, orang kata. So sometimes you need to take just a little bit, alright, just a little bit, so that you don't go dehydration pula, kan? Don't
True.
go dehydration, or you have this electrolyte imbalance because we didn't eat anything. Just take something, walaupun tak banyak pun, maybe a little bit, okay, just to help you with your life. Alright.
Yeah, that is true. Even though we wanna, we just take a little. It doesn't have to make ourselves go hunger until we lost weight too much and everything. So we have to control also on that matter. Thank you, Doctor
But
Shu. That yes, you can add.
but if you have this significant loss of weight, again, please don't hesitate to see your
Yes,
doctors. Always
definitely.
remind that. Yeah.
Yeah, definitely. If we don't know what to do, go to doctor is the best option for us to actually know what is happening to us. Because even though we can self-diagnose, it's very important to get a proper diagnosis from doctor so that we can know what to do next after. So thank you very much, Dr. Shu. I believe you have answered a lot of questions, and thank you for extending your time, because I believe you only say until 2:30, but we have been going for a little bit longer because there's a lot of question asking today. So thank you very much, Doctor. And thank you to everyone who has give your question to us through Slido, Facebook, and also YouTube. And Doctor, just to summarize of what we have been talking about today is that we have talking about what is anxiety, why we get the anxiety, what are the symptoms, and how we want to manage it. And it's not only just psychology or mental; it can also be the surrounding. It can also be the biological factor that make us have this anxiety. So this is a very packed session, and if anyone who just came in and you missed out all the other session that we have just talked about, no worries, there will be a recorded one you guys can talk about and can see this video again on our YouTube page as well as on our Facebook page. And for you guys' information, Dr. Shu, as I mentioned earlier, she is from the Young Mind Malaysia. It is a social organization enterprise that is helping the youth to get the necessary help, especially in the field of mental health. So if you guys have a more question that you guys want to ask, but we cannot answer it today, go and check the website for the Young Mind Malaysia, and Dr. Shu will be there to help you guys to actually answer any of the question that you will need to her to help. So go on and check the Young Mind Malaysia. So Doctor, again, thank you very much for spending your time with us. And Chop, Dr. Chop. I have not done that. I have not done that. Okay, just a little bit of your time is that I would like to share with you and also to the audience who are watching right now. I just get the information from my director is that we from the MMU Center of Alumni, they are going to have their own talk show next week on 24th February 2021 Wednesday from 3 to 4 p.m. And they're going to be live on Facebook, MMU Malaysia, as well as MMU Malaysia TV YouTube. So to anyone who is interested to see our alumni, you may do so and watch their show next week live. And if you want to see our alumni, please do join the session next week on Wednesday, 24th February. And so with that, Alhamdulillah, we have finished our session today. Thank you very much again, Doctor, for joining us. Thank you very much.
Thank you so much for inviting me. I'm so sorry for anything if I wrongly said anything. So thank you so much for joining. I appreciate all of your attendance. So thank you so much, MMU, for inviting me.
Yeah, I think, Doctor, the only thing that happened just now was the technical error when you suddenly go missing and give me a little bit of anxiety.
I think that is not a technical error. We just play prank because this is talk about anxiety.
Oh yes. Oh, Doctor is playing prank with me in live. Wow, Doctor. Wow. All right. So thank you again, everyone, for watching Choke. And
Thank you
with
so
our
much.
today's, thank you very much. And we'll see you again on the next topic of Choke. But then, Assalamualaikum and bye-bye.
Waalaikumsalam. Bye.
Ladies and gentlemen.
Do you know if you litter, you will be penalized? Do you know it is wrong and prohibited to keep exotic pets? You cannot simply say, I don't know the law and get away with what you did. These are the topics on our Legal Talk. What you don't know can hurt you. Don't forget to watch Alumni Vibes on Wednesday, 24th February at 3 p.m.